Welcome, everyone. Welcome to tonight's session with Sunnie and I. We're going to discuss the Mosaic Organic Acid Test. This is a test that I use on most of my patients with ADHD and autism. And I do use it for kids who have other types of problems, whether it's gut problems or nutritional issues or mitochondrial issues. And it's really a nice grab bag test, if you will. It's one of those functional tests that you will find something on anybody you test. So looking at it from a certain perspective is what I'm going to highlight today, basically focusing on children who have ADHD and autism, but also understanding that each of these markers on this test is telling a story, and we're building a case. We're building an understanding of the physiology and biochemistry of the cells in the patient. So it's not diagnostic in the sense of, oh, if you have this marker, you have this diagnosis. It's more like, if you have this marker, you probably have something going on in this area and you need to explore more. So it's kind of a screening test. And I use it very, very often. Sunnie, have you had experience with this test?
Yes, I feel like just about functional medicine practice or holistic practice that I've worked with uses this specific test.
Yeah. And I like the Mosaic for children because I'm looking, especially with autism and ADHD, we're looking for certain markers that we'll see further down on this page. The Genova organic acid test is wonderful too. It just doesn't show me these particular markers. So I tend to use the Genova more in older patients, and this test I use in younger patients. So let's dive right in. On this first page of the Mosaic, and this is, by the way, a dummy test. It's just a dummy mock report that the company shared with physicians so that we can actually explain the markers. It's not any particular patient you're seeing here. The first 9 markers on this test are reflective of mold or yeast toxins. So these are markers like you see here, citramalic, hydroxymethyl 2-furoic, etc. Those are toxins or poisons, chemicals that the mold or the yeast makes if they're infesting your body. These two here, tartaric and arabinose, are particularly telling of yeast, whereas the other markers are more, I would say, particular to mold. So when we look at these markers, we're trying to decipher, is there mold exposure? Maybe that's why, if a child is sleeping in a room that's got mold in it, or has a bathroom that's got mold in it, or in a classroom that has mold in it, you're going to have issues with these markers. They're going to be more elevated. And actually, Mosaic has another test that's a mycotox test, also a urine test, which is specific to all the toxins that are found in exposure to mold. So I'd like to do both of those tests, but for tonight's purpose, we're just going to focus on the organic acid as a screening test. Looking further down, we see here bacterial markers. So each one of these, again, is telling a story. And oftentimes, if there's dysbiosis, meaning an imbalance of bacterial ratios, bacterial family ratios, because we have trillions of bacteria in our gut microbiome, and it's really about the balance, the harmony, the cohesiveness. Are they living well together, or is there more pathogenic bacteria that are causing inflammation in the body? So when we see a disruption in these ratios here in the center, we are painting a picture of, okay, maybe there's just dysbiosis. Now, in this particular individual here, they seem to have a pretty nice microbiome, don't they? It's pretty harmonious. However, sometimes I'll see this number 11 elevated, and it's not anything bad necessarily. It could just be that this person's diet is high in foods that have phenols, like blueberries and strawberries and apples and things like that. So they eat a lot of fruits and vegetables, and that number 11 can be elevated because of the chemicals from that diet. So we have to look at the whole picture, all the markers together, not just one isolated marker at a time. Is that making sense so far?
Yes.
Great. So let's look at the next Clostridial markers here. Clostridia is one family of bacteria that we see in the gut. And oftentimes, if any of those 4 toxic markers are elevated, it could definitely trigger symptoms of autism and ADHD. And that's why like this test, because it's really the only patented test on the market that looks at these markers specifically. The Genova test, for example, does not look at these specific markers. It looks at other clostridial markers. So understanding that if we have an elevated number 16, which is for short HPHPA, or cresol, the 4-cresol, those are pretty bad toxins to have elevated. In this picture here, we see that, they're average or low, and that's reassuring. So when you see them on this top side, twice as elevated or more than twice as elevated, those are troublemakers, and we definitely need to do all we can to kill off the Clostridia so that we're rebalancing the ratios of the microbiome. And I like that this test, they give you a lot of graphs and they try to explain where in the Krebs cycle, for example, this is in the mitochondria, in the motor of our cells. This is happening where you're going to have all these markers that they're measuring in the urine. But if there's any imbalance of these markers, too high or too low, it's maybe indicating, okay, there's a block in this reaction. For example, here they're telling us if there's a heavy metal issue or toxicity that impacts this enzyme, succinic dehydrogenase complex 2, in the electron transport chain, then we may have an elevated succinate level on our tests, right? And so knowing that, we may also see that malate or fumarate or oxaloacetate may be low because everything's backing up. It's like having a wreck on the highway or the beltway, right? Everything behind that wreck is going to back up. So you'll have elevated markers here, but lower markers down here. And then you've got internal reactions happening. And they do show where yeast markers can impact those levels as well. So this is just a clue for the doctors who are interpreting this test, but I think parents can also glean a lot of good information if they have the time and the patience to read through the report. I'm going to show this next graph, which is what's happening in the brain. And as you know, dopamine is one of the main markers for focus, for motivation, for concentration, and reward. And if there's a block in the dopamine beta hydroxylase enzyme, it could be a block because you have copper deficiency or vitamin C deficiency, or if you have an elevated HPA, for example. So if you see that dopamine is backing up, but there's not enough norepinephrine markers, and in this case, we're measuring the VMA and the HVA on the test. We'll see that in a little bit later section. That we have to go upstream from that to figure out, okay, where's the deficiency happening? Do they need B vitamins? Do they need copper? Do they need vitamin C? And so that's where we bring in other testing to try to figure out where's the hiccup, right?
Dr. Nahas, are these graphs specific to the patient that the report is on, or is it just an overall?
Yeah, this is just the explanation of where you're seeing those markers and the major pathways.
Okay.
Yeah, so this is not particular to the patient. I think they may show one particular to the patient further down. So we saw the oxalate metabolites, and I would say that a lot of my children with autism have elevated oxalate metabolites because they have an impairment in the breakdown of these metabolites, or they have yeast infection that's causing these metabolites to go up. So we often see a disruption here. Now, depending on whether glyceric and glycolic are also extremely elevated, those can indicate a genetic issue, like some genetic problem that's not going to be corrected with genetics. We're going to have to correct it by fixing the diet, but to override the genetics, basically. But if we see oxalic pretty high and the other two okay, then it may be a yeast infection causing the toxicity. Lactic and pyruvate have to do with, the glucose and carbohydrate metabolism. So again, if they're super, super high, it's telling me that we're not processing carbohydrates very well. This could be for many reasons, a little bit too complex even for me to get into tonight's talk, but I just want to mention that we are looking at a lot of different ways the mitochondria are processing energy. So how they're breaking down carbs, how they're breaking down fats, how they're breaking down protein. All of these substrates give us energy to the mitochondria, which is the motor of the cells. And if there's any impairment of those three pathways into the Krebs cycle, we're going to see problems inside the Krebs cycle as well. So here's that succinate that we talked about earlier on the beltway. If there was a problem with the enzyme that breaks it down, we're going to see that level go high. In this person's case, everything looks normal. And sometimes on this test, the markers have a little asterisk, which we'll see that further down. And that means that if the level is looking low, it's not a problem. But if it's on the high side, then that indicates a deficiency. So we'll look at some examples like that. Amino acid metabolites are often okay. And on this test, I've not seen many that showed an issue. But this next section is very telling, the neurotransmitter metabolites. And I definitely look at this section much more carefully because I am dealing with children who have brain issues. So we look at the HVA, which is a dopamine marker, and then the VMA. And you can see already here, there's a discrepancy in how they are coming across. Like they should be in line, right? Like you should have as much dopamine as you do norepinephrine because the enzyme should be just moving things along naturally, right? But here we see there is a block to producing the norepinephrine or epinephrine, and we need to look at what's blocking that. So again, it could be, let me go back to the diagram. So we're going from dopamine down to HVA, right? Or sorry, dopamine down to norepinephrine here. So it's dopamine beta hydroxylase. That's often where the block is. It could be further down, but they're not telling us the name of that enzyme. So I'm thinking this is what they're trying to communicate about this particular enzyme. And that's where that PHVA, the clostridial marker, comes into play and can block this enzyme from working properly and then reducing the production in the body of norepinephrine. Clear as mud so far, Sunnie?
Yeah, I think so. On that, when you go back up to the diagram and it said copper and vitamin C, does that mean that replacing the copper and the vitamin C helps with that pathway?
Well, it could impact the pathway, and so can B6, by the way. And further up the line here, vitamin D and zinc are impacted as well. But I would think if it's more upstream to dopa, it's going to impact dopamine. So the fact that there's okay dopamine, but not okay norepinephrine on this particular section of the test, it's telling me that it's this level where we're impacted. So yes, we would look at HPHPA, copper, and vitamin C to see which of the levels are off and then try to correct that problem. And as you can see, if you didn't have that test, you'd have no clue, right? You would just see the symptoms of hyperactivity and lack of focus and all kinds of disruption, right? Restlessness and all that, impulsivity. But you don't know why. You're just seeing the outer symptom, and there's not a real test in the conventional medical model to tell us where the problem lies. We have to rely on functional tests to really decipher the equation. So that was a big insight right here. And you can even see the HVA to VMA ratio is elevated. So again, it's telling you have more dopamine to norepinephrine. So there's definitely an imbalance. I do look at DOPAC and HVA to DOPAC ratio. If there's a market, lowering or increase, but in this case, it's still okay. So I'm not going to worry too much about those right now. And then we look at the tryptophan metabolites because those are serotonin metabolites. So if your 5-HIAA number 38 is low, it's telling me you're making less serotonin as well. And that is something that pertains back to vitamin D, to zinc, to B6. And we'll want to know what's going on in those areas as well. The next two markers, 39 and 40, are part of the serotonergic pathway, but they're kind of inflammatory markers. And I say kynurenate is like how do you say that? It's like, it's definitely a marker for B6, vitamin B6. So if it's super, super low, I worry about vitamin B6 deficiency. But if it's high, it could just mean that the brain is inflamed, right? And same with quinolinic acid. That's a very inflammatory marker in the brain, causes a lot of damage. So if we see the high markers, we want to work very fast at lowering inflammation. The reason is it's permanent brain damage. You can't recover. The next section is DNA. So it's also looking at folate metabolism. So those are telltale signs of DNA damage. If they're elevated, that means your cells are just spewing out DNA into the cytoplasm. That's not good. So we do look at those briefly. And usually if people have a lot of DNA damage, they need a lot of antioxidants to try to mop up the oxidation that's happening, the stress that's happening, and try to help mitochondria rebuild, basically. The fatty acid oxidation, I mentioned earlier, we look at how fats are being metabolized in the mitochondria. And again, if you have very, very low markers, or in this case, they're not all extremely low. There's some that are low, but not all of them. But that could indicate that they may need help in processing fat. And a lot of times, for example, we'll supplement with L-carnitine and magnesium to help support this fatty acid oxidation and processing. Now, on this particular test, I am not often paying a deep attention to the nutritional markers because I prefer another test to do that. I prefer the NutriVal, but in this case, that's where a high marker indicates a deficiency, but when it's low, it's actually normal. So you have to read each one alone because like B6 here, I would say might be a little bit low, but the B12 is actually okay. You see what I'm saying? So it's a little bit of an illusion. You have to look at each marker on its own to assess, is it adequate or not adequate? And almost every patient I test, unless they just took vitamin C before getting the urine sample, their vitamin C levels are going to be low. So that does not represent a true nutritional deficiency. It's just that we process vitamin C so quickly out of our body that it doesn't hardly ever show up in your urine. So just FYI, don't panic if you see a low vitamin C marker here. CoQ10, I like to have CoQ10 because we need it as an antioxidant. And again, in this case, it's okay. It's only if the marker was on the opposite side of the spectrum that we would worry about deficiency. However, if you look at NAC, which is a precursor to glutathione, and glutathione is your master antioxidant, it's even more powerful than CoQ10 or vitamin C alone, that level is elevated, right? And it may be that this person is supplementing with NAC because you're seeing that that marker is elevated here. So we take that into consideration. I've had patients where their B12 was super low, actually super down here, and they were supplementing with B12. So again, you have to pay attention to the asterisks and what is the patient telling you in their history and kind of piece the picture together from all those viewpoints. Okay, let's move on to the next section, and that's indicators of detoxification. So glutathione is showing up again here. This marker, number 59, can be an indication of toxin exposure. Now, notice it has two asterisks. So a high value may indicate methylation defect and or toxic exposure. So if there is a high value up here, you may have you need more folate support or B12 support that's methylated, and or you've been exposed to some toxic fumes recently and your body's still trying to detox from that. Ammonia is an important marker because it's like a side circle to the Krebs cycle. It's a little bit of an offshoot. And if you have a lot of ammonia, you're going to intoxicate the liver and the brain. So we want to make sure that there's not excess of ammonia floating around our system because that's highly toxic to both the brain and the liver. And then marker 61 could indicate GI dysbiosis or, again, overwhelm of aspartame and salicylates from the diet. Like if you don't have the right enzymes as an autistic child, if you can't metabolize salicylates and aspartame, we do have to modify the diet if we see that this level is high. And a lot of times it's not just high, like barely high, like it's often 10 times as high or 100 times as high. So the test itself, with the magnitude of elevation, can tell me this is genetic. This is more than just like an exposure. Okay, so let's look at amino acids. So again, this section of the test I find not very useful. I'm not really sure, like they'll interpret each marker on the back of the test, and I'll show you that in a minute. But I don't find it very accurate about protein insufficiency or amino acid insufficiency. I like to do the NutriVal for that because that's a little bit more telling of what's really going on nutritionally. But it's part of this test, and I will glance at it. And if everything is, let's say, super low, I'll question, are they eating enough protein? Or if something is super, super high, or all of them are super high, again, I'll look at, what happened with the test. Like maybe they didn't do a fasting test like they were supposed to or something like that, right? I do look at the creatinine on the test because if it's less than 50, then I have to recompute where the line actually falls. It does alter all the results on the test. And if it's over 250, again, it will alter the results on the test. So we like the creatinine to be between 50 and 250, not below or higher. And this section, I move fast, but they're going to explain, the standard deviation, what that means. So if you want to read about it on your own, you can. And this is where I think they will show you as a patient, like where your levels are and the neurologic pathways so that you can see, how is this affecting me as a patient with the toxin levels, right? So do you see that now, Sunnie?
Yes.
Yeah. So this is your dopamine beta hydroxylase, and they're showing you the ratios, and then they're nice enough to say if it's high or if it's normal. So you can see it pictorially and you can see it numerically higher up in the test. Now, I wanted to actually explain something. When we give somebody Concerta or Adderall, what we're doing is we're blocking the reuptake. You see these vesicles here? Of course, they're supposed to be being emitted downward to the next neuron to communicate. But what we're doing with the drugs was actually trapping these dopamine molecules in the space between the two neurons. And there's not a reuptake vesicle of that medication, of that neurotransmitter, I should say, dopamine, norepinephrine, serotonin, any of those. So by giving the medication, we're concentrating the dumping of the neurotransmitter into that neuronal space or interneural space and allowing the chemical to impact the next nerve cell much more concentratedly. And that then kind of wakes up the brain and allows the nervous system to operate more normally than when levels are suppressed. So I just wanted to highlight that right here. It's not like the drugs are making more dopamine. It's just they're trapping the dopamine that the body's already making and allowing it to just work for a few hours while the drug is operational. And that's why the effect wears off at the end of the day, right? When you're back to your normal self, not being able to focus or concentrate or anything because the effect of the drug has wore off.
And so that's more like a tricking mechanism, right?
Yeah.
It's like your brain needs 200 milligrams of dopamine a day. The drug tricks your brain into thinking that it actually does have those 200 milligrams, and you never actually get them. You might have just 50, but the brain has tricked it into thinking that it has 200, which is why it's usually a need for more and more and more of a drug once it stops working, right?
Yeah. So your body's not making more of the neurotransmitter. It's just, it has what it has. And so with functional medicine, we're looking upstream. We're looking at, well, why is the body not making enough dopamine? Where's the block? So if it's the dopamine beta hydroxylase blocking epinephrine, norepinephrine? Is it less, lack of copper and zinc and vitamin D and other methylated vitamins? So there's a lot that goes into making dopamine, but at least we're asking the questions and trying to look on a test or several tests to see where are the glitches and trying to fill the gaps there, right? So if I give you more amino acids because I can see on your test you're not getting enough from your diet, you're not absorbing the protein, you're not breaking down the protein, I can give you digestive enzymes, I can give you amino acids. We can do things to enhance your nutrition and making sure that we're giving the substrate, the building blocks that the body needs to make that dopamine or norepinephrine, right? If you have clostridial markers or yeast markers, those have to be eliminated, right? So we have to treat and kill off the yeast and kill off the clostridia and rebalance the microbiome. That doesn't happen in one day. Like, we need a program. We need to do it over 2 to 6 months. So it's not a quick fix, but at least we get to the root of what's causing the imbalance.
Makes good sense.
So the last part of the report is just each marker, and they're telling you all about them. If you can't sleep at night, that's a good report to read. It's very sciencey, but it's not a long report. I didn't count the markers, about 70 markers, 77 markers, right? 77 markers. So, I mean, if you had a lot of weird things happening, of course, yes, you would want to take your time and read the report and really lay out a program. Okay, we've got this constellation of problems here and this constellation here, and start designing a program of how are we going to fix these gaps, because maybe we just need more nutrition, maybe we need more enzyme, maybe we need more methylation, maybe we need more probiotics, right? But we don't know until we look at the test to see each individual, what is their particular need and where are they falling through the cracks that's causing the symptoms that we're seeing.
Dr. Nahas, would you think that that's a good test for a lot of times for children that don't like blood work? Is that like a good starting point, or is that?
It's an easy test to do, right? We're just collecting urine. It's the first morning urine sample. I like to do it literally first morning. Like, you go to bed, you pee through the night, throw that away. And then the first morning sample, you gather part of that, you ice it, ship it back to the lab. And within a few weeks, we have the results. Definitely pain-free, easy to do, and very convenient. It's just more of a screening test, though, than a diagnostic test. So I don't say that I use it alone. I use it as part of the blueprint I'm building to understand what's going on in the body. But yeah, I've had kids who just didn't want to have any finger pick or blood drawn. And so we start with what we can. We might do a stool test. We might do other urine tests, and hair tests. There's a hair test that I can look at heavy metals and toxins and also look at your vitamins and minerals. So I'll use whatever tests we can get until we can build up rapport and hopefully convince the child to do the blood work.
Right. Good deal.
Yeah.
I think that was a great explanation.
Thank you. I mean, it's not a simple test, and I have to say it's taken me years of listening to lectures and trying to understand each marker, and I kind of went fast today because this is just introduction to the test. But when I sit with parents, I'm actually going through each marker and what it means for that particular child, because we really want to be on the same page when we move forward into the next step. We understand why it's important to do that next step. Like, why do I need to kill the clostridia, right? I'm not aware there's clostridia. I don't see diarrhea. I don't see vomiting. Like, they don't have abdominal pain. Like, why are we doing this rigorous protocol? So once we see the markers and how they're impacting the brain, it's like, aha, now we understand.
Yeah.
So thanks for joining me. I always enjoy having your company, Sunnie.
Absolutely.
We'll do this again next week. Hopefully people will join and we'll have some questions. Let me just make sure. Yeah, I don't think I have anybody asking a question. But if you have questions, please put them in the chat below. We'd love to have your input. How are you liking these sessions? Are they valuable to you? Are they giving you information you've been looking for? If not, I want to know because I want to modify what we're offering, what we're teaching about so that it meets your needs. This is what this group is for. It's not just to be entertainers and educators. I mean, it's fine, but I really wanted to offer you value and to really help you and your children. So with that, I bid you all a good night and have a great evening. Thank you.